You mentioned the word ptotic eyes. There are some eyelids that actually the whole eyelid comes down further on one eye than the other, and there are some medical problems that cause that. So what do you do with ptosis?
That's correct. Assuming there are no underlying medical problems that need to be addressed, if it's just truly an age-related change, which can happen in some individuals, then that is another situation where typically surgery is indicated. Although there are some ways to avoid surgery, the definite procedure to fix it is a surgical operation, and you can either go from the outside, where you make an incision on the outside of the eyelid, or from underneath on the inner surface of the eyelid, and basically work on the muscles that lift the eyelid to help them start at a higher point.
I would think, and I don't hear of that surgery being done much. We see people with ptosis where the lid falls, and that means there's less of the white of the eye that you see. Mm-hmm. Is it easy to get those muscles to work back? Is it really touchy? Is it something you try to avoid?
Having done an oculoplastics fellowship, I feel very comfortable doing that type of surgery, and that's something I do all the time. I would say that it's pretty easy to get the lid higher up in most cases. The most delicate part of the surgery is symmetry, because obviously not everybody's made symmetric, and we're not born that way, and it's hard when somebody operates on you to get that symmetry just perfect, because once it's been touched by someone else, patients tend to notice a little bit more. So.
If you've got ptosis, is it usually just on one side? So if one lid is falling down, is it usually one side, or both of them can be falling?
Now, usually ptosis is a bilateral process. It means both sides are involved. However, it is not completely unusual to have it affect one side and not the other two.